Welcome everyone to our Tuesday night chat. I'm Kelly Wilkins, your host, and I'm super excited tonight to be joined by Jessica. Welcome, Jessica.
Thank you for having me, Kelly.
We are so thrilled because we've been talking about all things natural health, and Jessica is going to share with us all about homeopathy, and I'll introduce her in a moment. But before I do that, I just want to congratulate our winners from our raffle that we held 2 weeks ago. If you receive our email, you would have seen the winners pop up in that email. But if you haven't got your raffle tickets yet, please grab them. You can go onto the website myselfreliance.com.au, and lots of our local businesses who are you'll see come up at the Freedom Summit on this channel. Lots of people who support Self-Reliance are giving away amazing prizes. And I'm also giving away a 2-night stay for 2 people at the Lily Ponds Retreat in Warranalla, which is inland 20 minutes from Bulahdelah. So you would love that if you win that prize. You can kind of pick whatever dates you like to come and join us at Lily Ponds Retreat. So go to the website, check out the amazing prizes. Tickets start at $5 for a ticket, or you can get packages, and the bigger the bundle you get, the more value it is. And grab your raffle tickets. The next draw will be on the 2nd of September. So just over maybe 6 weeks to get your tickets in, and then we'll draw those amazing prizes. So also, if you haven't seen, a huge announcement that we made 2 weeks ago was our summit from the 24th to the 26th of October. We have opened our doors, thankfully, to our raffle and our sponsors. We're making our summit a free event for guests. So you can enter and join in the amazing stalls, the yoga, the sound bath, the ice bath, the family barn dance, lots of good activities there. And if you want to get into the doors to see the speaker sessions, because we're going to have amazing speakers throughout those 2 days, then we only have 100 tickets to give away at $60 a ticket. So you can go on and grab those as well. So all the things that we do on our Tuesday night calls, we bring it all together on those 3 days and get in person, where we really love to meet everyone and amazing store holders and who are doing demos and workshops, and it's the place to be. So save those dates, the 24th to the 26th of October in Kenthurst. So just outside of Sydney, just a little bit. And you can camp on site. So that's the fun part, is go there and set up a tent or bring your caravan, all good things. So let me introduce you now to our beautiful Jessica Goh, who is our homeopath. She is an advocate for empowering mothers to use homeopathy in the family home for both first aid and for optimal health for families. She has so much experience, and also in holistic approach to healthcare. So looking at a person from the inside out, and I love that so much. So Jessica, tell us, first of all, for anyone who's new to homeopathy, maybe some people would know what a naturopath is, but what's the difference between a homeopath and a naturopath?
Yes, good question. So naturopathy, if you've ever seen one, you will probably notice that they would use herbs in their raw form. So the herbal tinctures that they dispense at the end will probably be brown and quite bitter tasting, or that have a strong taste. With homeopathy, we also, I know naturopathy, they deal with the mental, emotional, physical. We do that as well. but the actual difference is in the remedies that we prescribe to our patients. So the remedies are not in its raw form. The remedies are made in a particular way. And I'm going to actually talk about this because this is what differentiates homeopathy with naturopathy. And essentially, homeopathy is energetic medicine. And so you're probably seen that the medicines come in drops or dispensed in little pills, like the little pills are medicated with the homeopathic medicine. And so that's the difference. And this difference is actually gives us the capability to use all sorts of things, like all sorts of remedies, because with naturopathy, using the raw form, you can't use herbs that are, I guess, poisonous, right? But with homeopathy, we use a lot of minerals, plants, animals, and we can use poisonous things, like I'll talk about arsenic and album, which is made from arsenic, which is a heavy metal, which is poisonous, or belladonna, which is a plant that's deadly, but we use that. And so I'm going to explain the process in which the remedies are made, because this is really, really fascinating, really interesting, and why it's so powerful for us.
Yeah, that is fascinating. Wow, you can, because I know some of those, the belladonna and the arnica and the arsenic. So yeah, please. Do you want to share your screen? Are you in? I'll let you take it away.
Beautiful. Okay, so I'm just going to. Can you all see that?
Yes,
Yep.
beautiful.
So just quickly, this is a little bit about me. This is my son. He was about 2 at this stage, but he's 6 now. And, you know, I actually studied interior design, and I was an interior designer for about 6 years before I became a homeopath. During this time, you know, it was very stressful. I did love interior design, but I remember I would go to architectural parties and industry nights, and everyone around me would be talking about buildings, and I'd just be thinking about, you know, healing the body and the relationship of our body and the emotional connection and how we can heal. And I just knew I was in the wrong spot. You know, I knew I was in the wrong crowd. So I was also seeing a beautiful kinesiologist at the time that used a lot of homeopathy in her therapy. And I was just amazed with the shifts that I was getting with, you know, emotions and things like that. So I enrolled into homeopathy in Melbourne at the College of Natural Health in Melbourne. And I studied there, and I've never looked back. And it's just been such a useful tool for me as a mum, for children. And that's what I specialize in now. I treat a lot of children with behavioral issues, allergies, eczema, things like that. So my son, this is a picture of him when he was little. He had a lot of eczema. He had, you know, it was covering his face. You can see on his cheeks, it was really dry. He would have to wear socks on his hands because he would just be scratching his face, and it'll be weeping everywhere. And I'll tell you later about homeopathy and how I used homeopathy to detox his system from all sorts of things. So the first thing was the labor medication, because I ended up having a cesarean, and those medications went straight to him, you know, because he was in me, and he got a whole lot of the pharmaceutical medications. And, you know, eczema is, the root cause can be many different things, but I think it's also toxins coming out of the body and the liver unable to process all of these things. And the beautiful thing is with homeopathy is that I was able to clear his body from the labor meds that he had. And when I did that, it took about 4 weeks. His skin completely changed. Like, it was incredible. And, you know, I'll be talking about first aid with you today, but I'll also touch on some other ways in which homeopathy can be really, really effective because it's energy medicine. just quickly, there used to be, like in the 19th century, homeopathic hospitals. This is one that was in Melbourne, or two that were in Melbourne. And because of, I don't want to go down the rabbit holes, but then there was a certain stage where, there was funding for homeopathy, for, I guess, mainstream Western medicine to be more popular and to be more supported throughout the world. And so the homeopathic hospitals kind of disappeared, unfortunately. But really, my dream is for, Western medicine and homeopathy and, even Eastern medicine to all work together, because these are all such useful modalities to heal holistically, because that's really what we want to do, is have that holistic healing and our bodies to do what it's meant to do, and that's to heal. It knows exactly what to do. So just a tiny bit of the history. So this is the founder of homeopathy. His name's Samuel Hahnemann, and he was a physician. He was a chemist, a medical physician, and, he became delusioned working in the medical practice, working in that industry, because at that time, that was when there was a lot of like bloodletting and things like that. And he was just kind of like, this is not right. I'm not feeling like this is supporting the human body, the mental, emotional states of these patients. So he ended up just taking, a break. He was very smart and intelligent. He knew 5 languages. And so he ended up translating a lot of medical books. And as he was translating a lot of medical books into different languages, he came across this article, which is about this cinchona, which is a Peruvian bark. And the article was about an experiment where if you take, it's an experiment about this particular Peruvian bark healing malaria. And so what he did, he was like, that's really, really interesting. So I'm going to do some experiments about this. So what he did was he ended up taking minute doses of this cinchona, of this Peruvian bark. And what he found was that it actually, his physical body, he started getting symptoms of malaria. And so what he found was that cinchona produced the symptoms in a healthy person, which was him, like the very disease it was known to cure, which was malaria. And so this is when he found the law of similars. And this is the principle of homeopathy, the law of similars. So the law of similars is anything capable of producing symptoms of the disease in a healthy person can cure those symptoms in a sick person. So anything that can make you sick can make you well. So I'm going to give you some analogies of this so it kind of, it resonates. So for example, there's a remedy, homeopathic remedy called coffea. And coffea is made from coffee, okay? So imagine, whether you drink coffee or not, imagine you had 3, 4, 5 cups of coffee in a row. What would happen to you? What physical symptoms, or even mental, emotional, what would happen to you? Can someone write in the chat perhaps, or come online and just tell me what would happen to their body, what would happen to their mental state if you had 5 cups of coffee, if you had 10 cups of coffee, what would happen?
It would just be overstimulated, though you won't be able to think properly and always be so jumpy, and I guess your brain just won't be able to cope, and you'll crash so hard afterwards. It's just like a temporary dopamine hit that's not really good for the body at all.
Yeah.
Mm.
Yeah, 100%. So you would be wired. Your nervous system would be going a million miles per hour. You might even get like sweaty palms. You might get heart palpitations. You might not be able to sleep. You might lay down at nighttime that night, and your thoughts are just going over and over, and you're just racing. You might have anxiety, those sorts of things. Spot on. So if someone comes to me in clinic and says, Jess, I can't sleep at night. I go to bed, I have racing thoughts, I can't switch off, I have heart palpitations, and I've got anxiety. And then I think of the remedy, coffea, because coffea has got all of those characteristics. And so this is the law of similars. So then I would prescribe coffea to the person, and all of those similars that are the same in the remedy and the same in that person, once we give the remedy, they get alleviated. It's almost like, if you can imagine two magnets, you know, if you've got two positives and they are being pushed together, they repel each other, right? You can't actually push them together, or the two negatives, the same thing happens. It's like that. I'm going to give you another example. So Alcepa is a homeopathic remedy made from onions. So what would happen, again, if you were chopping up a 10-kilo bag full of red onions on your kitchen bench top, just one after the other, you're chopped finely dicing them, what would happen to you?
Besides crying, besides...
Yep, you'd be teary.
Yeah, sore eyes.
Yep, your eyes would probably be stinging. Your nose might be running. And this is a really good remedy for hay fever. You know, where you've got that nasal watery discharge, your eyes are, you know, weeping, things like that. I'm going to give you another one, which I mentioned before, arsenicum. So arsenic. And, you know, you probably haven't had an experience with this, but in old movies, you might have seen arsenic poisoning, you know, in the olden days. Do you guys know what would happen if that happened to you?
I thought it would kill you, wouldn't it? You could die from arsenic.
Yeah, you can die from it. I guess it depends on the dosage. But what you would see is like stomach cramping, you'd be vomiting, you'd have diarrhea. Arsenicum is a really good remedy for barley belly, for gastro, for where you have stomach cramping, where you've had food poisoning. I always prescribe this remedy for people that are going to Bali, and they're like, what remedy should I take? I'm like, take this one, you know? So can you see how the remedy and the symptoms that you have, they're similar? So this is the law of similars. This is how homeopathy works. It's that similar characteristics in the remedy and then similar symptoms that the person has got. Okay.
It's the first time I've heard of the law of similars, Jess.
Okay.
Yeah, and that you, because normally you would do the opposite. So how does it actually work then? How does that, taking something that produces that, how does that happen?
The way that I feel it and the way that I see it is that the things that are the symptoms that you've got, so for example, if you're needing coffea and you've got that racing mind and you've got the sweaty hands and the heart palpitation, these are all things that are not are symptoms that are showing that you're not in alignment, right? They're symptoms that are of someone that's unwell. You know, you're not healthy, basically. You're showing these symptoms because your body is not in balance, right? And so the remedy that carries this imprint of sleeplessness, racing mind, heart palpitation, it's almost like a catalyst to push it out of your body. That's how I see it, you know, and it's almost like a magnet, and it pushes that out of your body. And when I explain to you how the remedies are made, it might help you understand more, because I keep saying it's energy medicine.
Okay, great. Thank you.
I know it's a bit out there, but trust me, this is why it's so incredible. So the totality of symptoms. So as homeopaths, we work by treating the whole person. So the entirety of symptoms experienced by a person, mental, emotional, physical, spiritual, and it represents the disturbance within. So homeopaths treat the whole person. When an individual is healing, we usually see an improvement in mood, energy, and sleep. So this is really interesting because when I see a client for a more in-depth, let's say chronic condition, it's an hour and a half of talking, of really understanding the health history and interventions and trauma and things like that. And when they come back after 4 or 5 weeks, I always ask them, how is the main complaint? How is your mood? And how is your energy? And how is your sleep? Because these are the things that you will see improvement with when your body is healing. So, for example, I had a lady and she suffered from chronic constipation for, a decade. And I gave her a remedy. And when she came back, I was like, how are you feeling? She's like, I'm feeling amazing. Like, not only am I able to go now, I feel completely satisfied with that, digestion's all good. But also she goes, what's weird, Jess, is that every day I ride my bike and I usually do this lap. And it's just, I've been doing that for a long time. And ever since I've been on the remedy, I've been going further. Like I've actually gone, double the distance and doing a bigger circuit. And this is how it works, because it's not only about your digestion, it's about your whole being, and being uplifted, being more what we call homeostasis, more in balance. And so you'll sleep better, your energy would be better, and so on. So it's a real holistic treatment. So this is a beautiful professor, Japanese guy. I'm not sure if you guys are familiar with him. His name's Dr. Masaru Emoto. He dedicated his life to do a lot of experiments on water. And he carried out a series of experiments to test the effects of words, thoughts, and emotions on water. So he conclusively proved that our intentions, our thoughts, imprinted onto water. So what he would do, he would have water like in a petri dish, and he would have people, these water samples would have labels on them like love, forgiveness, hate, and so on, all different types of words, or even water that was exposed to music. And so what he found over so many experiments was that the positive thoughts and music, the water was then frozen, and then he would find beautiful, harmonious, crystallized patterns on there. And with the water that was exposed to, negative music, negative thought patterns, showed really disharmonic patterns on there. And I'm going to show you some examples. So these are just some examples of what he found when water was exposed to. Thank you, wisdom, truth, I love you, polluted water, evil, you make me sick, those kinds of things. So the reason I'm showing you this is because water is a carrier, and water has the ability to hold and store information. Okay, and so if you think about our bodies, we are about 80% water. And like, how do we talk to ourselves? What are the thoughts that we say to ourselves or to others? So I just wanted to talk about this because the next stage is about how homeopathic remedies are made. And I wanted to give you a little bit of understanding about the water and how it is a carrier of information and can store all sorts of information and data. So this is how the homeopathic remedies are made. So let's say we're making coffea. This is the remedy from coffee, okay? And so we've got coffee and filtered water as a starting point. This is the mother tincture. Let's say we're making a C. So homeopathic remedies are, C is the Roman numeral for 100 parts. And so we're making a C potency. So this is the coffee mixture, and you take 1 drop of the 99 drops and you put it into 99 drops of water, and you succuss it 10 times. So succussing is another really important part in the remedy making. It's banging the remedy and the little bottle vigorously. In Hahnemann's day, he would pound it on a leather-bound book 100 times. And this process is infusing the coffee and the water molecules together vigorously, so 10 times. So when you finish with that succussion, you're left with a 1C. 1 is 1 part, C is to 100, 1 part to 100, okay? Then you take 1 drop of this 1C and you dilute it into 99 drops of filtered water. Again, you're succussing it. You're infusing, you're energizing this remedy. And then that you're left with 2C, that should be a 2 there. Then you take 1 drop again and you dilute it into 99. You're succussing it again, and that becomes your 3C. So you can see that every time you dilute and succuss, it potentizes it. In homeopathy, we use 6C, 30C, 200C, 1M, 10M, 50M, and beyond. So you can see that we just keep diluting and succussing. After, I think it's 7C, and you look and you've got your mixture of water, and you look at it under a microscope, like a standard microscope, you won't see any coffee in there at all. And this is why mainstream media ridicule homeopathy. Well, they used to. And they would say, there is nothing in this. It's actually just water. It's only placebo because there's no coffee in there. But what they don't understand is that the water is holding all of this, has been imprinted upon with the coffee. When I studied this, because I knew about homeopathy and I already, it worked on me. And when I knew about how the remedies were made, I was just absolutely blown away, So the substance goes through a series of dilution and succussion. The more dilute and succussed, the stronger it becomes medicinally. And, in homeopathy, we use really high potencies as well. And the higher you go, the more it can treat and shift the sort of generational stuff as well. Like it can go really deep into generational trauma and traumas that, your mum and dad or your grandparents have held in the cells. So is homeopathy safe? Yes, it is safe for adults, babies, children, the elderly, animals, pets, and plants. And so although homeopathy is safe and non-toxic, you can prove symptoms if repeated dosages of a medicine is given and not needed by the body. I just wanted to put it in there, but it doesn't happen a lot. But if you're giving the remedy to somebody repeatedly, like I would say, 6 or 7 times, and there's been no change and it's not the right remedy, they might start to take on some characteristics of that remedy. So for example, if you're giving coffea a lot and it's not the right remedy, maybe after 6 or 7 times, they might have trouble sleeping. But don't worry about that. You just stop giving the remedy and then it will just dissipate in the body. But, it is very safe for babies, children of all ages, animals, and, they even use it for plants. It's called agroopathy, and they use remedies and they put it in their water and it helps with pests and things like that, so it's very extensive. Just the basics with how to take the homeopathic remedies. So sometimes they can be in pill format, sometimes they can be in drops, and really they're both the same. It really just depends on what you prefer. So with the pills, you would just tip 2 pills into the container, and then you would just pop the 2 pills in your mouth, and you just let the pills dissolve in your mouth. I always say that homeopathy is best absorbed on a clean palate. So you don't want to be eating or having coffee or, brushing your teeth. You just want to make sure that your mouth is clean and then that you put the 2 pills in there. If you're having drops, then that's fine as well. You just put 3 drops into the mouth in a clean palate. Try not to touch the pipette with your lips or mouth because that can contaminate the rest of the mixture. In terms of storage, I would just keep them away from, strong odors, perfumes, away from EMFs. So I would just put them in like a medicine cabinet, so it's away from sunlight and things like that. Okay. So in terms of like what we're talking about today, like what is an acute illness? What is, in your experience, what is an acute illness? What does that mean?
Would it mean that that it's progressed quite far, or would it mean that it's quite a dangerous illness?
Acute actually means less than 3 months, and usually acute is something that comes on suddenly, or chronic is the opposite. So chronic is something that's been more than 3 months, and perhaps every time you have your monthly cycle, you get your headache. That's chronic because it's always happening, or eczema that you've had for many years, or something like that. But I'm going to cover more about acute. But Andrew, was it Andrew? I just saw your question. And
the dosage of the arsenic.
Yes.
Yeah.
So like you would really need to know the dosage. With homeopathy, because there's no raw substance of the arsenic in the remedy, you could take the whole vial and you're not going to get poisoned, basically.
Yeah, now that you've explained the process about the dilution, I understand that. Yeah.
Yeah, perfect. Beautiful. Okay, so categories of acute. So you could have contagious illnesses such as viruses, colds, chicken pox. You can have mechanical injury of acute, so like accidents, injuries to your back, falls, bruisings, sprains or strains. You can have contamination or environmental acutes like burns, food poisoning, insect bites, stings, or you can have overindulgence, so being hungover, having indigestion, reflux, etc. So these are all different sort of acute situations. You can also have acutes from a chronic state. So these are things like asthma. Perhaps every time you have a cough or a cold, you get asthma. As I mentioned before about migraines, maybe you get it monthly or when something happens, or arthritis, or you might have persistent colds every winter, bronchitis, pneumonia, or recurrent cystitis, or recurrent anything. These are acutes from a chronic state. And yes, you can use the remedies for these things. You definitely can. But from a homeopathic view, if you're getting them, let's say monthly or quite often, you want to really address the root cause, because this is what homeopathy is about. Homeopathy is about addressing the root cause and asking, why is your body behaving this way? Why is your body always getting migraines every month? Is that a hormonal thing? Is that let's look into that deeper. But I just want to put that here because this is important if you're wanting to really heal from the root cause. So with acute case taking, it's really important to note that the key to prescribing is individual. So 2 people can react differently to the same bug or causation. So for example, if I have 3 kids and they've all got tonsillitis, Yes, they might all have the common symptoms, which are the same, like, sore throat, maybe it hurts when swallowing, but then they'll have other symptoms that are different. And they might not necessarily all have the same remedy, because we are all such individual people, and we will present with tonsillitis or whatever it is in a different way. So it's very important to, I'll talk about how you have to be like a detective, and you have to observe and see what their symptoms are and then match those symptoms to the remedy. So one of the things is differentiate from normal health patterns. So for example, if somebody is normally very thirsty, they've always got a bottle of water next to them, they're always drinking water, and then all of a sudden they're sick. Well, let's say they've got a cold and they're like, I can't have water, I just don't want to drink. That's something different to their normal health patterns. And they're the things that you want to look out for, that you want to take note of, because they're the things that are, how I was saying before about how your body's not in homeostasis, and these are the symptoms you want to alleviate. So it's showing that the body's not in its normal state. So that's one of the things that you look out for. With case taking, generally you want to look at the location. So where is the so if it's tonsillitis, it's like the throat. The sensation is, what does it feel like? Is it burning? Is it throbbing? Is it does it feel like I don't know, prickling? Like what's the sensation there? Because these homeopathic remedies are very specific when it comes to their characteristics. And so you want to get the closest remedy that's got all of those specific symptoms that you're experiencing. And then when you have it, it'll just be gone. That's how it's the law of similars, right? Modalities you want to look out for. And modalities is, if you've ever been to a homeopath, they'll always ask you, when is it worse and when is it better? So for example, maybe with the tonsillitis, it's better when I'm having warm drinks, or it's better when I'm having cold drinks, or it's better when I'm not talking, or it's worse when I'm talking. Things like that. It's always like, when are the symptoms better? When are the symptoms worse? And the generals are the physical generals. So like you might notice that you're really hot, or you might notice that your child has got a fever and their face is really flushed, but their feet are really cold, So it's really about looking at all of the body, their mental, emotional, their physical. Obviously, always seek medical advice in emergencies. You can utilize home doctor for diagnosis. Like, this is for mums, or even, I know that I used home doctor a lot, and that's just like you call a doctor and they come over and they can help you. And, I don't want to say doctors are bad. I have utilized doctors a lot, and they've helped me with diagnosis. And then they've given me a script. I haven't filled the script, but I've gone then to my homeopathic remedies and I've utilized. I'm like, oh, I know what it is now, because they've helped me with the diagnosis. And now I just look at my book. It's like, oh yeah, it's this. Because once my little baby, he had nappy rash, but I didn't know it was nappy rash because he had eczema. I was just kind of cleaning his nappy, his groin area, and he was screaming, and I thought it was something that was around, his groin area, and I was really worried. And the doctor came and said it's nappy rash, and I was like, oh. And he gave me like cortisone cream or something like that, and I was like, I'm not going to use that. But I looked in my book for nappy rash, all the remedies. I gave a remedy, and the next day he was fine. So don't be afraid to use their expertise as well. So you need to be like an owl. You need to be like a detective, and look at, their facial, what their face looks like, their eyes, their gait, their appetite, if they're thirsty, all kinds of things, verbal and non-verbal expressions, common and uncommon symptoms, and uncharacteristic symptoms as well. These are all really important. So we can have a look at some remedy pictures. I know we don't have that much time left, but I also I love this picture. You know, when I graduated from school, I went to India and I ended up working in a homeopathic clinic in Mumbai for a while. And I mean, this picture I found on the internet, but I visited homeopathic dispensaries like this, you know, like old remedies that I just utilized. And there were 100 people at the clinic door, you know, just waiting for treatment. It was just incredible. So has anyone got any questions? Because we don't have that much. Are we finishing at 9 or?
Yeah, it's probably good to take some questions now. And I do know that you were wanting to share with us a bit more about some of the first aid things that you can use and do.
Yeah. Okay. Ksenia, did you have a?
Yes. Just a quick one. I remember you mentioned about a treatment good for barley belly and the gastro. Do you have the name by any chance of the treatment?
So the remedy, I'm going to put it in the chat. Arsenicum.
Just to know for future. Oh, beautiful. Thank you.
The arsenic one.
Yeah. Arsenicum. Awesome. Thank you so much.
You're welcome.
Jessica, could I ask a question?
Yes.
Just wondering, I saw on one of your slides it said like back pain, etc. So back pain is going to be muscular, yes? Muscular. Oh, my question is, are there any remedies for things like tendons, like damaged a pulled tendon, or my daughter's got a meniscus tear that's not going anywhere?
Yeah.
Is there any sort of remedies that can be used for that type of thing?
Yeah, definitely. So what comes to mind is rust tox, and that's really good for tendons and ligaments and things like that. But again, it's about finding the more detail. So, you know, what does it feel like? When is it better? When is it worse? Because there's always going to be more remedies that are good for tendons. Like there'll be a group of remedies that are good for tendons and ligaments, right?
Yep.
And then they're all specific depending on how she feels.
Okay.
Depending
Yeah.
on the symptoms.
And just another quick one, if you don't mind. To find a good practitioner, she doesn't live with me, so she lives down on the peninsula. But, you know, to find a good practitioner, do you have any tips?
Yeah, so I guess it's
inside that question, I guess the thing is do you need someone who you can visit, or can you do it remotely? And also, what are you looking for in a good practitioner? Because, you know, I just know from naturopathy there's good ones and then there's not so good ones, and so you don't know.
Yeah. No, you're right, Kelly. You're right. I mean, I've been dealing with a naturopath for quite some years, and I just amazed at a couple of successes we've had that, you know, the doctors said, no, you need to do this for 3 months with all these terrible side effects, and managed to get very positive results. So I know it's hard to know. I suppose if you can get a recommendation, it's always good. I know there's one an hour or so from me. However, it's very hard to get in to see them. So that's another problem you've got. Yeah, so just...
And could she see Jessica?
I guess she could. And Jessica, do you do like Zoom things?
I do.
You
I
do?
see all my clients online. So I see clients from all over Australia and interstate. But yeah.
Okay, well, that's good. Perhaps I'll can get some contact details for you, because she's lost her part-time job now because she you know, she has so much pain with it. And yeah, so I think, yeah, thank you. Is that okay to get some details from you? Or I could just find you.
Yeah, we definitely pass on Jessica's details
Yeah.
and some
Lovely.
other options for you, for her as well. So
Yeah, that's great. Thank you. Question finished now. I'll leave it to someone else. Thank you.
Beautiful. Thanks, Joanne. So I was going to talk about some remedies, but I think we're not going to have time for that. But I wanted to talk about the first aid kit because these are really important and really just so handy to have at home. You know, I actually have one in the car and I have one at home. But this is a remedy kit that has got 20 of the common first aid remedies in there. And it comes with a little book as well, which has all chapters of like different ailments ranging from like stomach aches, fevers, cuts, bruises, burns, you know, conjunctivitis, all sorts of first aid ailments. And then it has a little breakdown of the remedies that are suitable. And then what you do is you just read and you go, okay, which one are the symptoms that I have got? Which ones are the symptoms that resonate with me the most? What am I going through? And then you administer, and it's got details on there and how to prescribe as well. But basically, these are some really common first aid remedies. So, for example, aconite's a really good one for first stages of a cold and flu, especially if you've been, let's say, you're gardening outside or something like that, and the sun goes down and then you catch a bit of a chill and then you come inside and then you know, you're like, oh, I think I'm getting sick. I think I've caught a chill. Aconite's a good one to take. Aconite's also, and you know, these remedies, they're not only good for one thing, they're good for multiple things. So as I said, this one's good for the beginning of a cold and flu. It's also really good for a cough that sounds really croupy. And it's also really good for, think of aconite, it rhymes with fright. And let's say, God forbid, you've seen something like a car accident, or you've had an emotional shock, or could even be trauma from 20 years ago where you've never been well since. Your body's still holding that trauma. Like I had an incident where a client's husband was on site and he had to save someone from being squashed on an elevator, and he hasn't been the same since. Aconite will remove that shock, that fright from the body. So these remedies, and unfortunately, I'm not going to have time to go through all of them, but they're not only good for one thing. You will probably use the one remedy for fevers all the time, and then, you know, a year later, you're like, oh, I didn't know that that was good for separation anxiety for my dog as well. That's weird. You know, like they're so multifaceted that it's really, they're so useful. And the more that you utilize and experiment and become more confident with using the remedies, the more you'll understand how deep they are. But basically, there's 20 here, and it ranges from, you know, hay fever, allergies, to bites and stings, to having, you know, a burn on your hand, to being heat stroke. Histaminum is a good one for like allergies. Instead of taking a Clarentine, you can take histaminum. Cocculus is a really good one for like vertigo or dizziness. There's Ipecac in there, this one here for nausea, for vomiting, for seasickness, for vomiting, coughing that leads to vomiting, that anything with that nausea or that vomiting picture. Ledum is an amazing one for like, you know, when people step on a rusty nail and they're like, oh, I need to get a tetanus shot. You don't need to get a tetanus shot. You can just use ledum. That will help with that bacteria. Nux vomica is really good for food poisoning. When I was in India, I took a lot of Nux vomica because my stomach wasn't used to, you know, the I guess the street food and things like that. So this is a really handy kit to have. And you know, my dream is that families buy a kit and then they start using it in the home, and then they impart this knowledge to, you know, their children and their children, and it changes the paradigm of health as we know it, because it's about taking back the power of instead of running to the GP and going, oh my God, what am I going to do? It's like, I know what to do. I know what to do with this. And you use the remedies and you utilize this knowledge. I wanted to talk a bit more about other things, but I'm not sure if we have time.
Look, it's okay. It's okay to go a little bit over. You don't have to stop right on 9. So you'll probably get another 10 minutes actually.
Okay. So yeah, these kits are really amazing, and it's $255, and there's no, you know what, if you legally we're meant to put a use by date on them, but I would tell you that they last forever. They're actually, you know, I've had homeopathic remedies given to me with super old labels that are like 50 years old, and they still work. So these are remedies that will last you forever, unless you need a real refill and you need to, you know, want more of that remedy. But they're super handy to have, and I take them with me when I go to an Airbnb, when I go camping, you know, and it's just so useful. Another thing I wanted to talk about is what you can do with homeopathy, and this is what I do a lot in my clinic, in my practice.
Andrew asked, is there something for spider bites or snake bites?
Yeah, so bites would go for Apis. Oops. Apis, this one here is really good for bites. It really depends on what the spider bites. I would do Apis, Arnica, because Arnica is a really good one to promote healing. I would do Ledum as well, because that's really good for puncture wounds to the skin.
Do you increase their value by doubling up on, or like you do with essential oils, or is that not the same?
So with administration, if the situation is very intense, like let's say a snake bite, you want to administer the remedy more frequently, because you are matching the intensity of the symptoms, what you're going through, and with the remedy. So you want to give it, let's say, every 10 minutes, you know, because if the situation's really intense, the body's going to use up that remedy quite quickly. So you want to give more of that remedy more frequently.
Just also to add, would you need to mix those remedies together? So you mentioned arnica and two other ones, or you have to take it one by one, the 10 minutes, and then say take another one, a different one.
If it's like a really emergency situation, I would definitely just mix them together, because you don't have time to wait, right? If like a snake bite. But if it's not really an intense situation, then you can give them separately. It really depends. Yeah. So did you have a particular situation in mind?
Oh no, just say like the snake
Yeah.
bite, for example. So you would mix those 3 together and take it every 10 minutes. Yeah.
Yeah, I would. I'm
okay.
in an intense situation, so I'd want to just give the body, you know, all the healing and the remedies. I wouldn't be taking one and waiting half an hour, you know.
Yeah.
Yeah. Okay. So with detoxing, and as I mentioned with my son, you know, I cleared the labor medication from his body. I do this a lot with my clients that have got chronic things going on. So for example, women's hormonal health that they've had a history of, like the oral contraceptive pill. I always detox the oral contraceptive pill, even if they've had it 10, 20, 30 years, because that is such a hormone disruptor to their, you know, that delicate cycle. So I detox that. Or I've done detoxing steroids for someone that's had skin issues and they've had a lot of steroid use. You know, the steroids is suppressing what's going on, and the body's actually not able to be as vital because they've had that suppression there. So I would then clear the steroids. Or even with vaccines, I've worked a lot with babies, children that have had vaccine damage, and sometimes the parent is like, it was definitely from a particular one that I noticed regression. So then I would detox that particular vaccine from the child's body. Or could even be the, you know, all sorts of things. It could be a never well since situation where I you know, maybe 10 years ago, I took Roaccutane and my skin's has never been the same since. Then I would clear that from the system, you know. So because our body holds all of this information, and the more, unfortunately, when there's a lot of suppression through pharmaceuticals and intervention, our bodies can't really thrive, you know. Another thing that I do is homeoprophylaxis, which is this big word here, or other words, we call it HP. And HP is homeopathic immunization. So this is for families that are perhaps choosing not to vaccinate their children in the mainstream way. But they're like, well, how else? What, you know, we've chosen to not go down that path. But what can we do to protect against infectious disease? Well, we can use homeoprophylaxis. And homeoprophylaxis is where we've got the homeopathic remedy made from, let's say, pertussin, which is the whooping cough bacteria. And it's made in that way that I was telling you about with the dilution succussion. And then it's given to the child or given to the parent for protection against whooping cough. And how it works is that it gives your body that energetic imprint of pertussin, and then you've got that, your body has got that understanding of what that looks like on an energetic level. So then when you come across it in your external environment, your body already knows what to do. It's actually like a vaccine, but homeopathically, without all of the, you know, heavy metals and all that sort of stuff. And so over winter, I would always give my family, you know, the influenza homeoprophylaxis, because flu's obviously going around. It's like giving the flu shot, but in homeopathic. So I'm giving my family the influenza imprint over the winter months. So then when you come across it in your external environment, you're not, well, a few things will happen. You might not even get any symptoms, or depending on how your immune system is, you might get a little sniffle, but not have the whole hog of the flu, because your body already has that energetic imprint of influenza, or whatever that remedy might be COVID. You know, I also give COVID as a homeoprophylaxis, you know. But for homeoprophylaxis for little ones, we have particular infectious diseases like meningococcal, rotavirus, Hep A, all those sorts of things for that protection, instead of using the normal vaccine schedule. So, you know, it's just amazing really what is available and what is possible with homeopathy. And I wanted to talk about that because that's not that well known, you know, but it's so effective, and it's so useful to know.
Yeah, beautiful.
Yeah.
Well, is there anything else that you wanted to cover that you didn't get to cover, Jess?
No, that's pretty much it. Yeah, I mean, I do run workshops where it's 4 hours long, and I go in depth about you know, the remedies and how to prescribe, when to repeat the remedy, when to stop, what to look out for, because it is a bit of an art form. It's not like a Panadol packet where you just follow the instructions. You know, it's very individual. And if a person's very sensitive, they might not need as much remedy as a person that is not sensitive, you know. So, but it's such a empowering tool to have, you know. And like I went camping and my son he got stung by a bee, and you know, he was screaming and everything, and I gave him one dose of Apis. I think I gave him two, one when it happened and one before he went to bed. And the next day he just had a tiny pinprick on his finger. But as soon as I gave him the Apis in his mouth, he stopped crying. You know, it was just it's just incredible. And yeah, I'm just wanting for all of you guys to hopefully be inspired and to, you know, want to utilize this beautiful modality. And, you know, if you're wanting to know more, I'm also doing some coaching calls next term for 8 sessions, and it's going to be over Zoom, Wednesday at midday, $88 for the whole 8 sessions, just for people that want to learn, that have got a kit and that just need a bit of guidance. Because what I find is sometimes people buy a kit and then they're like, oh, it didn't work, or what did I do wrong, or when do I prescribe again, and things like that. So it's just a little bit of support for you guys to guide you through your journey.
Yeah, beautiful. So do you want to put your details in the chat, and then also we will share for those who are watching the replay where they can find you, how they can get their hands on a great kit, because that's the first aid kit that every household needs. So Jessica Goh Homeopathy.com.
Yeah.
And you can see how to spell Jessica's name on the screen there. So Jessica Goh Homeopathy.com. And hopefully we'd love to have you at our summit in October. We can meet you there in person. And thank you to Mids, who introduced us at the Off Grid Festival last year. And Mids has a question. Go ahead, Mids.
I don't actually have a question. Hi, Jessica.
Hi, Mids. Nice to see you.
Nice to see you. Sorry I'm late just because of work. But guys, I just wanted to say that I've met Jessica, like Kelly just mentioned. Kelly and myself and another friend of us went to the Off Grid Festival, and I met Jessica there. And I did a session with Jessica. I bought the first aid kit, and we'll love it as a family. My kids are now so used to it. So whenever anything comes up, we use our first aid kit. I have built on top of the first aid kit with the help from Jessica, and the little booklet that comes with it. So whenever the kids feel they're in need of something, I actually give them the book now, right? Because I say to them, okay, or we go over it together and we say, what does it feel like? Is it more like this, or is it more like that? So the children actually decide, and the same goes for myself and my husband. We decide which one fits for how we're feeling right then and there. Because like Jessica, I missed a lot of the talk. Sorry, I'm sure you went over it. But like Jessica was saying earlier, from what I caught, is it depends on the person. And what works in one situation might not be the right combination in another situation. And this is why I've encouraged the kids to have a look at the book, and we go over it and we see which one fits the best at the time of how they feel, not what I think, right? But what they think, what fits the best. And we use the remedies a lot. I've stocked up a few times. I need more again. And what I love with the children is that they come and we call it our little balls, right? Mom, go and get me the balls. I'm feeling this way or that way. And I've got the little kit, so we always put it at the top so they can also, in a sense, self-treat, right? I don't give them, take it this many times or take it that many times. The kids will decide how often they need it or when they need it. So we'll leave it next to the bed, we'll leave it on the table. It's always accessible. Hubby's been treating his asthma with it. Like, love it. Love it, love it, love it. So I just wanted to do a shout out to Jessica because it has made a big difference in our family. And wherever we go, it's always with us. Or, you know, Kelly calls me, the kids meets up, oh, Ethan isn't feeling well. No worries, I've got a remedy.
That's right. That's right. Mids has looked after our family numerous times with the homeopathy. Yeah, with the little balls.
So I
I
always
love that so much, Mids. I love it. And it's so empowering for the children because they're more in tune about what's going on in their body instead of just taking a pill and doing that unconsciously. So well done.
Yeah, and that's the big thing, like I said before, empowering the children to see there is other ways than going, you know, and just getting something from the pharmacy. My kids don't need that. They love it. And I also wanted to say that whenever I needed help or information or emailed Jessica with questions, she's always been super helpful and replied, and we have a couple of phone calls, which is like, that's all right, you just do this, or you know, we add to it. And I had to send her a massive list because I was like, I want to add this and this and this, but I don't know. And she's, oh, Jessica, you also put me on the new book. Love it. You know, next stages of learning about it and see how it helps the family and really also the people around us. Because, you know, I had it given to Kelly during the move, and then they were like, where's the stuff? Well, Mitch took it home, and I'm like, you've got to get one.
Yes, that's right. It's taken me a while to get around.
So yeah, Jessica, I just wanted to thank you, and it was really meant that, you know, that we met at the Off-Grid Festival, and definitely the demonstration there was amazing, and we'll love the kit. Absolutely love it.
Oh, I'm so happy, Mids. So happy and so nice to see you. Thank you.
Good to see you too.
Joanne said, what I love about it is that you treat the whole person, and that's what the holisticness of it. So yeah. Jessica, did you have any workshops coming up that you wanted to talk about?
No, I don't. I just had one last month, but I am doing that coaching call one that's coming up at the end of this month. So anyone that kind of wants more guidance on their journey, then I am doing that. And if you just want to, if you're interested in that, just sign up on my newsletter on my website, and then I'll keep you updated with those details.
Amazing. And if we want to get a kit, then we would just reach out to you on the website.
So I've got a shop on the website, and you can just order it via there, or you can just email me on the website as well, and I can send it out to you.
Amazing.
Jessica, so is there a way to access this PowerPoint that you've shown just for the information, or is that all on the website as well?
I could send that out to you. Yeah. So if you want to email me on the website, and then I'll have your details and I can forward it on to you.
Okay, great. Thank you so much.
Otherwise, you can replay the video, but I know you did have some beautiful other slides there too with the other specific remedies. So wonderful. Well, thank you everyone for joining us tonight, and thank you, Jessica, for being our amazing special guest. We learned so much, and I feel so much more confident now, understanding you know, how to use it and the background. So wonderful. Now next week you want to stay tuned, because we have a guest speaker talking about what's in your food. So that's so many topics. So thank you everyone for joining us, and we shall see you next week.
Thank you for having me. Bye everyone.
Thank you.
Thank you.